Hi, I'm Dr. Ranj Singh. I'm an NHS children's doctor and I'm going to talk to you about looking after your child with fever. Fever is a high temperature of 38 degrees centigrade or more. It's a natural response to an infection. It should normally take around 1 to 4 days for your child or baby's temperature to go down. Here are a few simple things that you can do at home to help them feel more comfortable. Check your child's temperature regularly. In many cases, you can give them either paracetamol or ibuprofen if they're distressed or uncomfortable. If one doesn't work, try the other, but don't use both or alternate them unless a healthcare professional tells you to. The right dose for your child is shown in the packaging. Make sure you don't exceed the maximum daily dose. However, paracetamol should not be given to a child under 2 months old. And ibuprofen should not be given to a child if they're under 3 months old, they weigh under 5 kilograms, they have chickenpox, or they're dehydrated. Also, if your child has asthma, you shouldn't give them ibuprofen unless it's been recommended by a doctor. Don't undress your child or sponge them down to cool them. Equally, do not cover them up in too many clothes or bedclothes. Encourage them to drink little and often to prevent them from becoming dehydrated. You may find it helpful to use a syringe, and children with sore throats often appreciate cold drinks or ice lollies. If you're breastfeeding your child, just carry on, but remember to keep well hydrated yourself. Children with a fever may be becoming dehydrated if they have a dry mouth, they are crying only a few tears or even none at all, they have eyes that look sunken, they have a sunken fontanelle, which is the soft spot on the top of a baby's head, or they generally look unwell. If your child has diarrhea and/or vomiting, fluid intake is much more important than food. Again, encourage them to drink little and often to prevent them from becoming dehydrated, but not fruit juice or fizzy drinks, as these can make the diarrhea worse. Oral rehydration salt solution, sometimes called ORS solution, is good because it helps the body absorb fluid. The right dose for your child is shown in the packaging. Follow the instructions on the packet to make up the solution. For babies and young children, don't give them ORS solution unless advised by a medical professional. Check on your child during the night. They should respond to your touch, as they normally do when asleep. Keep them away from others while they have a fever and tell their nursery or school that they're unwell. And maintain the best possible hygiene standards to prevent infection from spreading. It's also important to check your child for rashes. If they have a rash that doesn't fade when you press it firmly, this can sometimes be a sign of a serious condition. Sepsis is a life-threatening reaction to an infection when the immune system overreacts and starts to damage the body's tissues and organs. It can develop quickly, so needs to be identified and treated as an emergency. So make sure you watch our film Spotting the Signs of Sepsis, which explains when you might need to worry. You know your child best, so trust your instincts. If you see something you're worried about, speak to a healthcare professional. You should call your GP 111, or for children aged 5 and over, visit 111.nhs.uk if you feel your child is getting more unwell, you're becoming more worried, or you're distressed or concerned that you're unable to look after them. You should call 999 in an emergency, such as if your child has a fever and has a fit, or has a rash that doesn't fade when you press it. For more information, click the link to the NHS website.